Hi, I'm pleased to announce an important new program that benefits our patients, our practice, and you, the staff. Because of recent changes at Medicare and private insurers, we can now proactively help keep our patients healthier. We call this program Advanced Primary Care. The innovative part of this program is that we are now able to place simple monitors in the patient's homes. These devices send us important data each time a measurement is taken. These are simple at-home devices like scales, blood pressure cuffs, pulse oximeters, and glucometers. The Advanced Primary Care system monitors that data stream. If measurements fall outside the predetermined threshold for that patient, the system can alert the patient's care team. You can then review the data, consult with the provider to determine a course of action, and then communicate this plan to the patient. Even if a patient has no alerts in a month, we will still review their data and make a monthly wellness call. Now, don't worry. We're working hard to make sure this does not add additional time to your day. We'll be setting up dedicated blocks of time for reviewing patient data, making wellness calls, and accounting for when you need to respond to an alert. We want you to spend the time needed to develop an ongoing partnership with your patients so that we can help them improve their health. With your help, the Advanced Primary Care program can spot early indicators of health issues before they become emergencies that require a trip to the hospital. Let me tell you a little bit more about how this works. After a regular checkup, the provider recommends which in-home devices the patient should use and on what schedule. For example, the provider may want the patient to weigh themselves once in the morning and once just before their evening meal. In addition, the patient should take their blood pressure in the morning and 1 hour after their evening meal. We then go into the system, set up the patient, configure the devices, and enter the schedule. Next, we teach the patient how to use each device. A communications hub is also supplied. The devices are pre-configured to send their data back to the system using that in-home hub. When the patient gets home, they just plug in the hub, and they're ready to start taking measurements with their new devices. The Advanced Primary Care system watches those measurements every day. If anything looks incorrect, we get notified so that we can go into the system and review the data. We can then determine the right course of action for that patient, be it a wellness check-in call, asking them to come into the office, or even recommending emergency intervention. Our partner in this program, Remote Care Partners, takes care of everything else. Technical support issues for us or the patients, replacing devices in the field if anything is broken, collecting the devices if the patient leaves the program, and even calling or texting reminders to the patients if they're not using their devices on the schedule requested by the provider. We truly believe that this is a revolutionary step in patient care. For the first time, Medicare and even private insurance companies are taking steps to keep patients healthy and out of the hospital. In the coming days, you'll have access to the Remote Care Partners team. They will teach you how to use this system. There is online training for you to review at your convenience, as well as plenty of documentation and a help hotline to the team at RCP. Thank you so much for taking the time to watch this video. We look forward to using this program to keep our patients healthier, and we hope it will end unnecessary or extra visits to the office so that you can spend more time with patients who are truly in need of your help.